So let's shift to the NHS. I think you were pictured this week with sleeves rolled up in full-on John Swinney mode in A&Es, presumably trying to reassure.
Actually, see that picture? That wasn't taken when I was on an A&E visit, because I said I didn't want a camera with me when I went to the emergency department of the Royal Infirmary, because I wanted to see as it was. It wasn't a kind of politician visits, It was politician goes there, First Minister goes there to see what is it like. Tell him it the way it is, and it was incredibly valuable doing that. Now the other photograph was taken when I went to another hospital and I had my sleeves rolled up in slightly calmer environment. in
that mould of seeing how it is, I know you were asked about it at FMQs today, but there's Royal College of Nursing report talking about how nurses are traumatised by the sights of patients having heart attacks in corridors and that sort of thing. How can that be a thing in 21st century Scotland?
There's a huge amount of congestion in their emergency departments, and it's been made acute by the colossal number of flu cases that we've been dealing with. So that's been the survey you're talking about, which I completely accept the comments made by members of the Royal College in Nursing. But those comments have been made at the most acute intensity of the Christmas and New Year period, with massive rises in flu cases.
It sounds like you're minimising what they're saying, and that it's not like that all year.
No. Well, if I'm doing that, I'm sorry for suggesting that. I'm taking that seriously. I'm acknowledging it, but I'm explaining that it's come at a moment of absolutely colossal intensity in the health service. Now, thankfully, those cases are now receding, and the report I got last night is that the pressure in the health system, it's not gone away, it's less intense than it was, is probably the fairest way I could describe it.
Well, let's talk about something that's not got less intense, which is waiting lists. I think in 2021, you were COVID Recovery Secretary. There were 603,231 people on NHS Scotland waiting lists. Plan published in 2021, pledging to turn that round. That's up 43% now. We've got 863,535. I mean, that plan's failed. What are you saying to people that are on these waiting lists?
What's happened is that because of the gap during the COVID period of addressing a lot of health conditions, and then the fact that because of that and the intervening period, people have, they've got more health complications and more health challenges. So one of the points it was very clear to me when I was in the A&E department at the Royal Infirmary in Edinburgh, was a point made to me by one of the consultants, that people are coming in with more complexity, so it's taken them longer to support people properly than it would have done in previous years. Now that obviously has an effect on throughput. So what we're trying to do is to expand national treatment centres, ensure that we've got more volume of cases being able to be treated, maximising the resources that we've got available to make sure we get through more cases, and to tackle that waiting time issue.
What do you think those waiting time numbers should be by the end of the year?
Well, we've said that by 2026, April 2026, we want to have nobody waiting 12 months for an outpatient treatment.
But those numbers could go up. That 863,000 could go up, even if that figure goes down.
We're working hard to get those numbers down and to make progress, and that's the commitment.
Will that number go down?
I would hope. I would. Yes, it will go down. Yes.
Right. Is your current Health Secretary, Neil Gray, just the latest fall guy? You're going to sack him, aren't you?
Not in the slightest. No way. Why would I do that?
Well, his waiting lists are up. All of the things we've already rehearsed.
It's tough out there, and I'm working really closely with Neil to make sure we've got all the resources and leadership and expertise in place to make sure we deliver for people in Scotland. That's what I'm about doing.